Well, leading hospitals through this unprecedented pandemic, of course, is challenging all across the country right now. And joining us is Dr. Steve Markovich, the CEO of Ohio Health. Doctor, thanks so much for being with us. We appreciate your time tonight. We know you were busy, to put it mildly.
My pleasure.
More than 100,000 hospitalized in America right now. We've been shattering records day after day. How does a hospital system like yours, one, deal with just that extraordinary influx, and two, how is your staff dealing with it in terms of just exhaustion at this point?
Well, the stress on the hospital system is significant. In Ohio alone, we've had more than 7,000 deaths now. We've got, at any given time, our ICUs are near capacity. 25%, 20 to 25% of any hospital system probably has their beds filled with COVID patients at what's the most busy time of the year for a healthcare system. So it's a very stressful time. Our staff is tired. Frankly, in some cases, they're downright exhausted. We're doing all we can with resilience programs and as much time off as we can give them, as many things as we can do to help with the stress. But it is a really tough time for associates, and they are the backbone of what makes it all happen.
And quick question, we've heard for so many months the medical professionals say that this was going to be a dark and deadly winter. As a medical professional, is it here?
It certainly appears to be. Like I said, the numbers are dramatic. In many cases, you're having to cancel elective cases. We've made that decision in order to make sure we've got beds for patients that are going to need our services across the institution. We're going to cancel elective cases. So that's a big decision to make for a hospital leadership and a board, but we think it's the right thing to do. Clearly, the opportunity for a vaccine being on the horizon is a great ray of hope, but even the time it'll take that to take effect will be, it'll still be weeks to months until we see both the ability to vaccinate our associates and the impact on their safety.
And that's certainly a long road ahead, and I know that as CEO, you have put a special emphasis on kind of keeping staff morale high, which is a wonderful thing. We want to play a quick clip of something you sent out to your staff. Let's play that.
To take care of our patients, and that we can't take care of our patients if we don't take care of each other. We needed to take care of you. So basically, we're providing associates with a double bonus this year. The annual balanced scorecard bonus and a pandemic. Thank you for all you've done.
Got to be honest, with so much talk right now about furloughs and layoffs and cutbacks and still lack of a stimulus deal on D.C., hearing you all give bonuses out, I'm going to go out on a limb and say that was received well.
Oh, yes. The associates were very happy. We've got a long history of stewardship at Ohio Health, and we were in a financial position to do it. Despite the pandemic, we didn't furlough anyone. We were able to give their annual merit raises. We gave them their traditional bonuses. And then we just said, let's just double the bonus, and let's give it to everyone. We can't figure out who's a frontline person versus a support person. They all deserve it. And so we made sure that all of our associates felt welcome.
I know you're a former military man, a fighter pilot. How does the military mentality, if at all, impact your approach to the pandemic?
Well, I think there's a lot of similarities. First, you've got to make sure you've got an organization that's values-based. You've got to make sure your people are trained and ready to do the job that they're here for. As a leader, you craft a vision, you put it out there for people, you get them to buy into it, and then you engage the frontline staff. You've got to ask those people what they need to be successful, put an intermediate level of leadership out there, people that they know and they trust and that have their pulse on what's happening in the organization. So that's exactly how the military operates. You know, create your team, give your team a vision, and turn them loose and let them go. And try, as leaders, we need to get out of the way. We need to help resource them, break down barriers, support them in what they're trying to do, and then not micromanage. So I think from my 38 years in the Air Force and the Air Guard, there's a direct correlation with how we're approaching the pandemic.
And we have 20 seconds left real quick. As a doctor on the front lines of this thing, what would you say, what would your number one bit of advice to the country be right now?
Well, people talk a lot about not fearing the virus, and I don't disagree with that, but you darn well better respect the virus. This is a serious disease, and it doesn't matter what your age is. It doesn't matter how much money you've got. This thing can basically impact and kill anybody, and we just don't know. So social distancing, wear your mask, follow the rules, and we'll get through this.
Dr. Steve Markovich, CEO of Ohio Health, thank you so much, sir, for your time and for everything that you're doing to help the country get through this in your neck of the woods there in Ohio. Much appreciated.
Thank you.
Take care.